Hello everyone, my name is Paresh Naik and today we are going to talk about vasculitis in the nose. So what is vasculitis? Vasculitis is a name of group of conditions that cause inflammation to the blood vessels. So what happens is, for some reason, the immune system attacks the healthy blood vessels, which cause swelling and narrowing. Most of the time, all we see is the end result because of the narrowing of these blood vessels, and depending on which site it has happened, it will be symptomatic at that site. So the causes can be hepatitis B, C, any cancer, immune diseases, or many medications. Signs and symptoms can vary from person to person and depend on the organ affected and the severity of the disease. Although the most common symptoms can be rash on the skin, fever, patient can complain of headache. Now there are n number causes of headache we know. Patient can also have kidney failure, loss of appetite, weight loss, aches and pain. You can see this in this figure how every organ can get affected. Starting from stroke, nosebleeds, muscle pain, and skin rashes. So why it's so important in ENT? Because the nose symptoms can manifest very early. So this is an endoscopy examination of a patient who has vasculitis. You can see that the nasal cavity has got crusts and thick mucus secretion. This is a classical case of vasculitis in the nose. The mucosa is erythematous. As we can see, there is generalized crusting of the nasal cavity. So you can see that crusting in the nasopharynx as well. So many of these times the patient complains with crusting in the nasal cavity or foul smelling discharge or even bleeding. You can see there are some bleeding spots. What happens is when the crusts fall down, they can trigger bleeding as they take some raw surface. Also, if the crusts stay there for long, it can form a site of infection, and these patients usually can have recurrent sinus infection or foul smelling discharge. One particular thing that you can see over here is that there is secretion and discharge in the eustachian tube as well. The eustachian tube is very clearly seen. Now, taking the scope further down and seeing if there is any other part which is getting affected, you can see there is, as I keep on saying, crusting everywhere. The crusting goes down to hypopharynx. In vasculitis, the vocal cords can also get affected, and also there can be hearing loss because the ear is also affected, the middle ear especially. In vasculitis, in case of vagus, the subglottic part is affected more common. You can see the vocal cord movements are normal, but can you see that crust sitting over there? Now it's clearly seen. Although the airway is fine, but the patient can complain of hoarseness of voice, breathing difficulty, stridor, and the diagnosis of this is usually a tissue biopsy. We have to look into ANCA, ANCA. The C ANCA is usually positive. The treatment is quite straightforward. The diagnosis is very tricky. What we have to make sure that the patient is started on immediate medications, and we have to refer to our rheumatology colleague. So cyclophosphamide, rituximab, steroids, methotrexate, and they may require long-term steroids. Thank you for listening. Please do like, subscribe, and share with your colleagues. And if you have any questions, please write down in the comment section.